India's healthcare system. Wow. It can feel pretty overwhelming trying to wrap your head around it, you know? There are so many layers and so many different things going on.
It's a vast and intricate landscape. Definitely.
And that's exactly why we're here today doing this deep dive, right? To break down some of that complexity for you.
Absolutely.
We've got some really insightful research and analysis that we've been digging into.
Looking forward to getting into it.
Yeah, and we're going to focus on 3 specific areas that we think are super critical. First, we'll look at that kind of push and pull you always see between public and private hospitals in India.
Always a hot topic, for sure.
Then we'll tackle the challenge of actually making mental health policies work on the ground.
Implementation is key, yeah.
And lastly, we're going to examine how medical equipment and devices are regulated.
Makes you think, right? All the stuff they use in hospitals, someone's got to make sure it's safe.
Exactly. And, you know, one thing that's become crystal clear from all this research is that political collaboration, getting everyone on the same page, is absolutely essential if we're going to see real progress.
Couldn't agree more.
So let's just jump right in, shall we? Let's talk about that public versus private hospital dynamic.
Okay, so it's a real dichotomy, right?
Yeah.
You've got public hospitals, which are like the backbone of the healthcare system. They serve a huge portion of the population, and they often offer care that's much more affordable.
Right.
But on the flip side, they're constantly struggling with limited resources. Then you have private hospitals, which can often provide a higher standard of care with newer equipment, more specialized doctors, that kind of thing. But that comes with a big price tag, and it puts that level of care out of reach for a lot of people. Think about what that means for someone who actually needs medical treatment.
Yeah, it's a tough situation.
Having to make those choices based on your financial situation.
Right. And the research we've been looking at, it really shines a light on those persistent challenges that public hospitals face. We're talking about a constant shortage of staff, outdated facilities, and of course those infamous long wait times.
Power wait times.
And we all know that those delays can have some pretty serious consequences for patients.
Absolutely.
So then when we look at the private sector, yeah, the quality of care might be higher in many cases, but the big issues there are accessibility and just basic fairness.
Right.
The cost creates a divide, and some of the analysis suggests that the focus on medical tourism could actually be pulling attention and resources away from the needs of local communities.
That's a really interesting point. I hadn't considered that angle before.
Yeah, it's something to think about. It's almost like, are they prioritizing international patients who can pay top dollar over the people who actually live there?
It definitely raises some questions about priorities, doesn't it?
And another layer of complexity is how the resources actually flow through the system. You know, the way government subsidies and some insurance schemes are structured, it seems like they often end up benefiting private hospitals more than public ones.
Ah, yeah, you see that a lot.
It makes you wonder, are those resources being used in the most effective way to help the most people?
Yeah, because some insurance schemes, they're meant to cover everyone, but the way they reimburse for services, well, it ends up being easier for the big private hospitals to navigate that whole system.
Right.
So the money kind of flows their way.
And, you know, on top of all that, the regulatory piece, you know, the rules and oversight, it plays a huge role in all of this.
Huge role.
The sources we've looked at, they point to these gaps in the regulations, which just exacerbates the difference in the quality of care you get between public and private.
Yeah, so without clear standards and strong oversight, it's really tough to guarantee that everyone is getting at least a basic level of quality.
So we've definitely got some big problems here.
We do.
But what's at the root of all this? You know, what are the political and policy barriers that keep this kind of conflict, this divide between public and private, from actually getting resolved?
Yeah.
It can't just be a matter of money, right?
Right. It's more complicated than that. A lot of the tension comes from the whole dynamic between the state and the central government when it comes to funding healthcare. See, in India, healthcare is considered a state subject, so the individual states are really in charge of providing it.
Right.
But a lot of the policies and national health initiatives, those are actually driven by the central government.
Oh, I see.
And that can lead to a lot of disagreements and confusion when it comes to who's actually responsible for funding what.
That makes sense. It's like the central government might have the money, but each state might have totally different healthcare needs and priorities.
Exactly.
And we can't forget about the private hospitals themselves.
No, they have a voice too.
They're not just sitting back and passively accepting whatever policies are thrown their way.
Right.
So are they actively pushing back against things like stricter price controls and regulations?
Oh, absolutely. They're concerned about maintaining their autonomy, being able to make their own decisions.
Right.
And they want to make sure they can still operate profitably in a competitive healthcare market.
Right, of course.
And that brings us back to the problem of underfunding for public hospitals, doesn't it?
Yeah, it does.
If there's political pressure to keep the private sector happy, could that mean public health care is getting shortchanged?
It's a real possibility. The research definitely suggests that other political priorities might be taking precedence, and public health care is kind of left behind.
And it's not just about direct funding either. There's also the issue of engaging the private sector in public health initiatives. That's been a challenge too.
Oh, yeah. Why is that?
Well, there seem to be a couple of big deterrents.
Okay.
First, private hospitals often complain about delays in getting reimbursed by the government for services they provide under public health programs.
Right.
And second, just the bureaucratic red tape involved in participating in those programs. It can be really cumbersome and time-consuming. So even if they want to collaborate, it's a hassle. So they might just say, forget it.
So we've painted a pretty clear picture of the problems and some of the roadblocks in the way.
Yeah, we've laid it all out.
What are some potential solutions, though? How can we actually bridge this gap between public and private healthcare? And just how crucial is that political collaboration we keep talking about?
Political collaboration is everything. I mean, it really is the key. Without it, forget about any kind of real lasting change.
Okay.
It just won't happen. It'll be one step forward, two steps back. One thing that keeps coming up is the need for stronger public-private partnerships, or PPPs as they call them.
PPPs.
Yeah, and those can take different forms. Like the government could contract with private hospitals to provide certain services, or they could invest jointly in building up healthcare infrastructure. But here's the thing. For those PPPs to really work and be fair, you need clear policies that everyone understands and agrees on. And you need genuine financial incentives that make it worthwhile for both the public and private sectors to get involved.
So it's not just about asking the private sector to do charity work.
Exactly. It's got to be a win-win situation.
Okay. And what about the cost of healthcare overall? That seems to be at the heart of so much of the tension.
Totally. It's like the elephant in the room, right? The cost. And figuring out how to regulate healthcare pricing, that's absolutely crucial. We've got to find a way to make sure people can actually afford the care they need without squeezing private providers so much that they can't provide quality care.
Right. It's about finding that balance.
Exactly. And that's where that political will we were talking about is so important, to actually implement and enforce fair pricing.
And when it comes to public healthcare specifically, there's just no way around the need for more investment, is there?
No way around it. We need a serious boost in public healthcare funding, and it can't just be a one-time thing.
Right.
It needs to be sustained over time, a long-term commitment. And that money needs to go towards fixing up outdated buildings and equipment.
Right.
We've got to address the staff shortages.
Right.
And we've got to bring in up-to-date technology. You can't expect the public system to serve the majority of the population if you don't give it the resources it needs.
It's just common sense.
Yeah.
Another thing that struck me in the research was this idea of standardizing the quality of care.
Oh, yeah.
Making sure it's the same across both public and private hospitals.
Right.
How would you even do that? Those sectors are so different.
Well, the basic idea is to have a set of universal medical standards.
Okay.
So it doesn't matter if you're going to a public hospital or a private clinic, you're going to get a certain level of quality care.
So it's about setting a baseline.
Exactly. And it makes everyone more accountable. They have to answer for the care they're providing.
Right.
And it also gives them something to strive for, a benchmark to improve upon.
Makes sense.
And finally, I think it's super important to have more transparency in how government healthcare schemes are run.
Transparency.
Yeah, people need to know where the money is going,
right,
how it's being managed, and who's benefiting from it. That helps to build trust in the whole system.
So we've talked about all these problems.
A lot to think about.
And potential solutions. If we could actually see real political collaboration and make progress on these issues, what kind of impact would that have on everyday people?
Oh, the impact could be massive.
Okay.
Imagine this. People wouldn't have to spend as much of their own money on healthcare.
Right.
More people would have access to the care they need, especially in rural areas that have been neglected for so long.
Yeah.
India's reputation for healthcare would improve on a global scale. And ultimately, we'd see a healthier population overall, which is good for everyone.
All right, so let's move on to another really important part of India's healthcare landscape that came up in our research, mental health.
Absolutely crucial.
It's great that there's more awareness and open discussion about mental well-being these days.
That's a good sign.
But what's the reality on the ground? What's the actual state of mental health services in India?
Well, while we're talking more about mental health, which is great, the reality is the system for providing mental health care is still really underdeveloped. It's just not equipped to handle the huge need that's out there.
Okay.
There aren't enough specialized hospitals and treatment centers.
Right.
And even more importantly, there's a massive shortage of trained mental health professionals. Psychiatrists, psychologists, counselors. We need more of them, desperately.
And it's not just a lack of facilities and professionals. No.
It's not.
There's still a huge stigma attached to mental illness.
Oh, absolutely. That stigma, it's so deeply ingrained in society, and there's just a general lack of understanding about mental health issues that keeps people from seeking help, even if it's available.
Yeah, it's a huge barrier.
It really is. And it's something that we have to address through education and awareness campaigns.
Okay, so we know there are policies and laws in place, like the Mental Health Care Act of 2017.
Right, a step in the right direction.
But it sounds like actually putting those policies into practice has been really inconsistent across the country.
Yeah, that's a problem. You've got this great act, but it's not being enforced the same way everywhere.
Why is that? Why is implementation so uneven?
A few reasons. One, there's just not enough money dedicated to mental health at the state level.
Okay.
And different state governments have different priorities.
Right.
Some are just more committed to mental health initiatives than others.
So it comes down to political will again.
In a big way, yeah.
We talked about the shortage of healthcare professionals in general, but it sounds like it's especially bad when it comes to mental health.
Oh, it's really bad. We're talking about a severe shortage.
Right.
Not enough psychiatrists, psychologists, counselors, social workers, anyone trained in mental health.
And that obviously affects people's ability to get the care they need, right?
Absolutely. Especially in rural areas where there might not be any specialists at all.
And it seems like mental health services are kind of siloed off from the rest of the healthcare system.
Yeah, they haven't been integrated as well as they should be.
What's the impact of that?
Well, it means people might not get screened for mental health issues during regular doctor visits. They might not get referred for early intervention.
Right.
And that can lead to problems getting worse and worse before they finally get help.
And then there's the financial barrier. Right.
Yeah, the money, yeah, that's always a factor.
If insurance doesn't really cover mental health care, that's a huge obstacle for a lot of people.
Huge obstacle.
So we got all these challenges on the ground.
It's tough out there.
What are the political and policy roadblocks that are making it so hard to improve mental health services?
Well, it's the same issue we talked about earlier, the split responsibility between the central government and the states.
Okay.
Healthcare, including mental health care, is mainly a state responsibility. But national mental health policies come from the central government.
Right.
So you can have inconsistencies in how those policies are actually implemented in different parts of the country.
So it's like a disconnect between the national vision and what's happening on the ground.
Exactly.
And money is a big issue here too, right?
Oh, absolutely.
The research shows that the amount of government funding that actually goes to mental health programs is tiny compared to the size of the problem.
Tiny. It's nowhere near enough.
And that lack of funding directly impacts how many services are available, what the quality is like.
Everything.
It's not just about having good policies on paper. It's about actually turning them into action.
Right. It's about action.
But it sounds like there's a lot of resistance to that. Why? What's holding things back?
Well, you've got bureaucracy, right? Things move slowly in government.
Yeah.
And then at the state and local levels, they might not have the staff or the infrastructure to support new programs, even if they wanted to.
Right.
And then there's just the overall lack of political will, that real commitment from leaders to make mental health a top priority.
It's like they're not putting their money where their mouth is.
Yeah, exactly.
And are all the different mental health programs out there actually working together effectively?
Not really. They're kind of fragmented, lots of different programs and initiatives, but they're not communicating with each other. They're not coordinating their efforts.
So you're saying it's inefficient.
Totally inefficient.
And when it comes to making good policy decisions, you need good data, right? You need to know what's actually happening out there.
Absolutely.
But how is India doing when it comes to collecting reliable data on mental health?
Not very well, unfortunately.
Okay.
We're lacking comprehensive, consistent data. We need to know how widespread mental health problems are, what the specific needs are in different communities,
Right.
and if the programs we have are actually working. Without that information, it's hard to develop good policies and allocate resources effectively.
Okay, so we've got this huge need for better mental health services.
A huge need.
What kind of political collaboration can make that happen? What needs to change?
First and foremost, we need more money.
More money.
Yeah, a lot more money. The government has to increase the budget for mental health services at all levels.
Okay.
Central government, state governments, local governments. It needs to be a priority, a real commitment.
And we've talked about public-private partnerships before.
Yeah, those are crucial here too.
Okay.
We need to work with NGOs and private organizations that are already doing great work in the mental health field.
Right.
They have expertise, they have networks, they can help us reach more people.
And we need to tackle that stigma head on.
Definitely.
What can be done on a policy level?
We need big public awareness campaigns.
Okay.
Educate people about mental health, destigmatize it, encourage people to seek help.
Right.
This needs to happen in schools, workplaces, communities. Everyone needs to be involved.
And we need more trained professionals.
A lot more. We need to invest in training programs for all kinds of mental health professionals, psychiatrists, psychologists, counselors, and we need to train community health workers who can provide basic mental health support.
And of course, we need to make sure people can actually afford mental health care.
Absolutely.
What can be done on that front?
We need to include mental health services in those big public health care schemes, like Ayushman Bharat.
Right.
That would make a huge difference in terms of accessibility and affordability.
And technology can play a role here, too.
Right, yeah, big time. Telepsychiatry, using technology to deliver mental health services remotely.
Right.
That can be a game changer, especially for people in remote areas where it's hard to see a specialist in person.
So if we could actually achieve all of this, if we could implement mental health policies effectively, what kind of broader impact would that have on India?
The benefits would be huge.
Okay.
Think about it. More productive workforce, fewer suicides, healthier communities. It would boost India's global reputation and even encourage more innovation in mental health research and treatment.
So for our last topic today, let's talk about medical devices.
A critical area.
All that equipment they use in hospitals, all those devices, it's a huge market in India, and it's growing really fast.
Super fast.
And making sure those products are safe, making sure they actually work, that's essential.
Absolutely essential.
So tell us, what's the current state of medical device regulations in India? Are they keeping up with all this growth?
Well, that's the thing. Historically, regulations for medical devices haven't really kept pace with how quickly the market's been expanding.
Okay.
You know, we've got increasing demand, new technologies popping up all the time, and the regulations haven't always been able to keep up.
So that's a problem.
It is a problem.
And one of the big issues, it sounds like, is that there isn't a dedicated regulatory body specifically for medical devices.
Right, that's a key point. They don't have their own separate agency. Right now, medical devices fall under the Drugs and Cosmetics Act.
The same act that regulates pharmaceuticals.
The same act, which makes sense to a certain extent, but medical devices are different from drugs.
Right.
They have their own unique risks and considerations. So having them lumped in with pharmaceuticals, it creates some complications.
So they introduced the medical device rules in 2017.
They did. Big step forward.
Was that meant to fix the problem? Did it work?
It was definitely a step in the right direction. Those rules were meant to provide a more comprehensive framework for regulating the sector, but the problem is implementation.
Implementation again.
Yeah, it's been kind of slow and inconsistent across different states.
So you got different rules in different parts of the country.
Basically, yeah. It's a bit of a patchwork, which creates confusion for manufacturers and healthcare providers.
And I understand that India relies pretty heavily on imported medical devices.
Yeah, we import a lot. More than 75% of the devices used in India are imported.
Wow, that's a lot. What does that mean?
Well, it means we're vulnerable, right?
Vulnerable to what?
To disruptions in global supply chains, you know, like what happened with all sorts of stuff during the pandemic.
Right.
And it also means that the cost of medical technology can be really high for Indian hospitals and patients.
And affordability is already a big concern.
It is.
Especially for public hospitals that are trying to serve a lot of people with limited resources.
Exactly. A lot of essential equipment and diagnostic tools, they're just too expensive for many public hospitals and smaller healthcare providers.
And without strong regulations, how can you guarantee that the devices being used are actually safe and effective?
That's a major concern. If you don't have strict quality control, you run the risk of substandard or even dangerous devices ending up in hospitals.
Yeah, that's scary.
It is. And it also undermines people's trust in the healthcare system.
And what about encouraging companies to manufacture medical devices in India?
Domestic manufacturing, yeah.
What's the status of those efforts?
There are some government initiatives to boost domestic production, but it's not easy. Companies face a lot of hurdles.
Like,
Bureaucracy, long approval processes, not enough financial incentives. It can be really tough for Indian companies to compete with established foreign manufacturers.
so what's at the root of all these problems? What are the political and policy barriers that need to be addressed?
Well, we see that same issue with coordination between the states and the central government. Different states might interpret and enforce regulations differently, so you don't have consistent standards across the country.
Okay.
And the whole process of getting licenses and approvals for new devices, it can be incredibly slow and complicated.
And that discourages companies from innovating and developing new technologies.
Exactly.
And the big global companies, they have a lot of influence too, don't they?
They do.
So when India tries to promote local manufacturing, those companies might push back.
Right, because they want to protect their market share.
It's a tough balancing act.
It is.
And then there's the issue of price controls, which are meant to make things more affordable.
Right, price controls.
But they can backfire, can't they?
They can. If you set prices too low, it can discourage companies from investing in research and development.
Right.
So you might not see the development of new cutting-edge technologies in India.
And on top of all of that, technology is moving so fast these days.
Super fast.
It seems like the regulations are always playing catch-up.
Yeah, that's a constant challenge.
Especially with things like artificial intelligence, wearable devices, all that new stuff.
Right, all that cool new stuff.
The old regulations just aren't equipped to deal with it.
Exactly.
So what can we do? What kind of political collaboration and policy changes do we need to create a more effective system for regulating medical devices in India?
Well, I think a big step would be to create a separate agency, a dedicated medical device authority that would take it out of the Drugs and Cosmetics Act and give medical devices the focused attention they need.
Right.
We also need to streamline the approval process.
Okay.
Make it faster, more transparent, less bureaucratic.
And what about those efforts to boost domestic manufacturing?
Well, we could offer more financial incentives, maybe tax breaks, to companies that manufacture devices in India.
Okay.
We could invest in building up the infrastructure they need, dedicated manufacturing zones and facilities.
And we need to make sure that quality standards are the same for everyone.
Absolutely. Domestic or imported, it doesn't matter. All devices should have to meet the same high standards.
And public-private partnerships could be helpful here too, couldn't they?
Yeah, they could. The government could work with private companies to make essential devices more accessible.
Especially in those underserved areas we've been talking about.
Exactly.
And finally, it sounds like India really needs a national policy specifically for medical devices.
It does. A national policy that sets clear standards for everyone, promotes domestic manufacturing, and makes sure that devices are both high quality and affordable.
Okay, so we've covered a lot of ground today.
We have.
We've talked about the relationship between public and private hospitals,
That push and pull.
the challenges in mental health care,
Huge challenges.
and the regulations around medical devices.
All intertwined.
And it's clear that all of these issues are connected in some way. They all come back to how resources are allocated.
Right, the money.
They all highlight inconsistencies in regulations and policies.
Yeah, it's like a patchwork quilt.
And they all point to the need for more effective implementation, actually making those policies work in the real world.
Action, not just words.
And I think the most important takeaway from all of this research is that none of these problems can be solved without real, meaningful political collaboration.
Couldn't agree more.
We need everyone to come together, central government, state governments, the private sector, everyone.
We're all in this together.
And to you, our listener, we hope this deep dive has given you a better understanding of just how complex these issues are and why they matter so much.
We've just scratched the surface, really.
But hopefully this has given you some food for thought.
And maybe inspired you to get involved.
Right, because the more we understand these problems, the better equipped we are to push for change.
Absolutely.
So as we wrap up, I have a question for you, our listener.
I'm curious, too.
Thinking about everything we've discussed, all those challenges in healthcare, public versus private, mental health, medical devices,
Good challenges.
what do you think is the single most important step we could take to improve healthcare in India?
Yeah, if you could wave a magic wand and change one thing, what would it be?
It's a tough question,
Mm.
but it's worth thinking about.
It is.
Thank you so much for joining us for this deep dive. We hope you'll continue to explore these issues and stay engaged in the conversation about the future of healthcare in India.
There's a lot of work to do, but together we can make a difference.
We can.